The great Sculptra debate. Does it cause scarring and make plastic surgery more difficult? Should you avoid it if you're thinking of doing a facelift one day? Why are there surgeons saying that this is the case? Why are there other surgeons in dermatology saying that this isn't true? I'd like to explain both sides to you today so you can have a better understanding of where these parties are coming from and you can see what makes the most sense to you and your face. If you like this topic, please like the video, subscribe, share with your friends, and hit the notification bell. Hi everyone, I'm Dr. Anya Weissman, and on this channel we talk about education, discussing aesthetic procedures, and skincare. So today's topic is the great Sculptra debate. I'll tell you why some surgeons are against Sculptra for patients who want to have plastic surgery in the future, and why other plastic surgeons and dermatologists think it's okay. We're also going to talk about where in the skin Sculptra should be placed and why that makes a difference. Let's start off with the plastic surgeons who don't want their patients to have Sculptra if they're ever planning on having plastic surgery like a facelift. If you imagine that a plastic surgeon takes anywhere from $50,000 to $150,000 for a facelift, you can imagine there's a lot of pressure on that surgeon to do a really good job. Ideally, for a surgeon, a face would be a virgin face that has never had hyperdilute radius, any Sculptra, any permanent kind of changes in scarring, no threads, and they know exactly what to expect in every plane of the face, and the surgery should go smoothly and beautifully. If the patient had had any procedures that could cause any scarring, like Sculptra, hyperdilute radius, threads, then that surgeon may encounter a scar that may make the surgery more challenging. More challenging surgeries sometimes lead to unexpected or not ideal outcomes. So that is the reason that kind of surgeon would just love a face that's had nothing done to it. Now, for the patient population that tends to get facelifts, most of those individuals have had minimally invasive procedures done in the past. Now, the reason why everyone is sticking to Sculptra is because it stimulates collagen and you can't dissolve it or make it go away. If someone gets Botox, if you wait 3 to 4 months, it'll be gone. If someone gets filler, especially hyaluronic acid filler, you can dissolve it. If someone gets Sculptra, you can't. However, a lot of patients that get facelifts get them again and again. More and more people are getting facelifts at a younger age, and they need a revision in 10 years and then another 10 years, and people are living longer and they're getting multiple facelifts. And as you probably guessed, someone who's had a facelift has way more scarring in their face than someone who has had some injectables or some threads. Yet, surgeons do take on these patients and they do revision facelift surgeries. Those surgeries are known to be challenging. Sculptra, when injected properly, is injected on the periosteum, which is a very, very thin membrane glued to the bone, so basically right on bone, or it's injected superficially just underneath the skin. Those are the two planes that Sculptra is meant to be used in. Facelift surgery focuses on a plane in the middle where all the muscles, nerves, and vessels run. So the layers of the skin look like that, or the face look like this. The skin, fat, where you can do Sculptra. This layer called the SMAS, where you have muscles, arteries, veins, nerves, all the important stuff that gets pulled up during surgery. Then you have another layer of fat, and then you have bone in a simplified version. So Sculptra is up and down, plastic surgery is in the middle. So how could it interfere with a surgery? Injection technique. If you get Sculptra injected by someone who is in the wrong plane, their technique isn't correct. They could actually inject the fascia or the membrane where that muscular layer lives. and cause some fibrosis there. So that's one problem that can occur, is that the Sculptra was just injected in the wrong place. So that is another reason for a surgeon to say, I don't want my patients getting Sculptra, because what if they go to an injector that's going to put that Sculptra in the wrong place? So there's another reason why a surgeon may be against Sculptra. The second thing to keep in mind is that everybody is different. And I think that's where this debate is coming from. There are many dermatologists who use Sculptra regularly. A great example is Dr. Shino Bay Aguilera. If you're familiar with him, he has been doing Sculptra since he was 37. He's 55 now, and he just had a facelift. And he had mentioned that in his conversation with his plastic surgeon, they were talking about the potential of finding a lot of scarring and adhesions when going into surgery, and actually the surgeon didn't find any, and the surgery wasn't complicated. So some people are more predisposed to scarring, other people are not. In general, the consensus seems to be that most people don't really scar, and they're fine and safe to proceed to a facelift, and they definitely have much less scarring than someone who's going in for a second facelift. But it's true that on occasion, some surgeons have seen patients have significant scarring after they've had Sculptra treatments, and it made the surgery more challenging. So it's those that are against it want to eliminate that potentiality of not knowing which group their patient belongs to. And those that are for are saying, well, most people are fine, so why should we prevent them from getting Sculptra for the small percentage that may get scarring? So that's what both sides are, that's the perspective of both sides. Now, the solution to this, which has been proposed and is already in motion, is to look retrospectively and see the data from the surgeons. How many surgeries have they done? How many of those patients had Sculptra? And of those, how many made the surgery more difficult, so that they can actually get numbers and put the debate to rest. Another factor I'd like to mention is taking care of patients on their journey to plastic surgery is also extremely important. So a good provider who is aware that their patient may want plastic surgery in the next year or two is going to start preparing that patient for that facelift. What does that mean? It means that about 1.5 to 2 years before the planned facelift, they're going to stop injecting biostimulators like Radiesse, like Sculptra. They will stop doing threads, both lifting threads and smooth threads, so that they minimize any kind of evolving collagen production. Then months before the surgery, they're going to be beginning to dissolve all the fillers. They're not going to do neurotoxins a few months before the procedure. And in that journey of that 1 year to 2 years, they're really going to promote skin health and get patients to have healthy, resilient, strong skin. Because a facelift without skincare doesn't actually make people look younger. Skincare is everything when it comes to facelifts. It is the icing and the frosting and the whole decoration on the cake. That's another way that a patient can observe and scrutinize a provider, by seeing, do they initiate this process, this journey of walking years into the future for that planned facelift. It's really a symbiotic process between the clinician, the patient, and the surgeon. And ideally, it's a collaboration where everyone is on the same page. And I think that that's the goal in the industry, to look at the numbers, to find out what the risks are, to find out how best to prep people for surgery. How early in advance do you really have to stop Sculptra? How much does it really scar? And once we have those numbers, people will feel more comfortable. And if you have any additional questions, leave them in the comments, and I will see you there, and I will see you in the next video. Bye.